In the next few minutes, I'll reveal the 7 personal hygiene mistakes that doctors immediately notice in their elderly patients and how correcting them could literally save your life or the life of someone you love. Did you know that doctors can identify serious health issues in their elderly patients simply by noticing certain seemingly innocent habits? These seemingly innocent habits could be silently warning you of dangerous conditions developing in your body right now, and what's really frightening is that most seniors have no idea they're making these critical errors every single day. Let me tell you about Harold, a 75-year-old retired engineer who believed his personal care regimen was ideal. The information I'm about to share with you isn't taught in schools, is rarely discussed in doctors' offices, and is hardly ever mentioned in health magazines, but it could mean the difference between living your golden years in good health or suffering from avoidable conditions that rob you of your independence and dignity. Harold was involved in his community, played golf twice a week, and never missed a baseball game with his grandchildren. During what he believed to be a routine checkup, his doctor discovered 3 serious hygiene errors that showed Harold had been suffering from a serious illness for months without my knowledge. Harold subsequently told me that if my doctor hadn't observed these seemingly insignificant hygiene problems, I would have assumed I was taking good care of myself. Even though I might not be here today to share my tale, I will disclose exactly what went wrong so you can avoid Harold's terrifying experience. More importantly, though, I will tell you exactly what to do in its place. Simple adjustments that could prolong your life begin today. The first is a disregard for oral hygiene. When was the last time you took a close look at your toothbrush? Is it worn out and frayed? Do you brush thoroughly twice a day? The more crucial question is, did you know that poor dental care is directly linked to heart disease, stroke, and even dementia? Don't believe me? Let me tell you about Sylvia, a 68-year-old retired Oregon school teacher. Harvard Medical School geriatric specialists have demonstrated that bacteria from untreated gum disease can enter your bloodstream and cause life-threatening heart conditions. In fact, their research indicates that seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems than those who maintain proper dental care. During a routine physical, Sylvia's cardiologist found dangerous inflammation in her heart valves, which she attributed to oral bacteria that had entered her bloodstream. The doctor informed her that if she had waited a few more months, the damage might have been irreversible. Sylvia had ignored her bleeding gums for months, believing it was normal at her age, and that's what happens as you get older. What should you do at this moment? Examine your toothbrush first. If it's older than 3 months or exhibits any wear, replace it right away. Ideally, switch to an electric toothbrush, which, according to research from the University of Pennsylvania Dental School, removes 62% more plaque than manual brushing. Brush twice a day for a total of 2 minutes each time. Never skip a dental checkup, even if you have dentures. If you need to floss every night, set a timer. Have you noticed any bleeding when brushing or swelling in your gums? These are warning signs your body is sending you. Don't ignore them for another day. The second mistake is not taking regular baths or taking care of your skin. Be honest with yourself. How frequently do you take a bath? As they age, many senas cut back on how often they take a bath. But did you know that your skin is your largest organ and that changes in its health might indicate major inside issues before other symptoms show up? Mayo Clinic dermatologists cautioned that seniors' decreased bathing frequency frequently conceals early indicators of diabetes, liver disorders, and cardiac difficulties. According to their clinical research, around 40% of unidentified medical issues in older people could have been detected sooner with appropriate skin surveillance. Take the case of Clarence, a 77-year-old retired Michigan postal worker. Clarence believed that taking a bath once a week was adequate, especially in the winter when his skin felt dry. He explained that he didn't want to dry out his skin, but when his doctor noticed unusual skin discoloration during an unrelated appointment, additional testing showed that he had early-stage kidney disease. The discoloration wasn't caused by poor hygiene, rather, the infrequent bathing had concealed a serious symptom that could have been identified weeks earlier. What is the remedy? Take a bath at least 3 times a week, even if you're not very active, and use a moderate, fragrance-free product. Use soap that won't remove your skin's natural oils after bathing, apply moisturizer while your skin is still slightly damp to seal in moisture, and most importantly, check your skin frequently for any unusual changes in color, texture, or sensation. If you notice dry, flaky patches or areas that are prone to persistent itching, these could be your body's way of telling you that something much more serious is going on inside. Don't wait another day to take care of these warning signs. Error 3. Disregarding nail care. Now, take a moment to examine your fingernails and toenails. Do you notice that they are clean, well-trimmed, and free of discoloration? According to the American Academy of Dermatology, when assessing senior patients, doctors look at the condition of their nails right away since it provides a window into their general health. Changes in nail health can reveal more than 20 different systemic disorders, including heart disease, thyroid problems, and anemia. According to their research, in approximately 30% of cases, nail irregularities in people over 65 resulted in the discovery of interior illnesses that had not been identified before. Let me tell you Beatrice's experience. At the age of 82, Beatrice stopped wearing sandals and concealed her thickened, yellowish toenails in closed shoes since she didn't think they were a cause for concern. When she eventually saw a podiatrist for foot pain, the doctor promptly diagnosed a fungal infection that had been allowed to grow for so long, revealing her severely suppressed immune system. Additional testing revealed a serious underlying condition that needed immediate treatment, but I assumed it was just a normal part of growing older, she told me. In order to prevent ingrown nails, you should frequently trim your nails straight across with slightly rounded edges. Nails wear breathable clothing and keep them dry and clean. Wear shoes, change your socks every day, and pay attention to any changes in the thickness, color, or texture of your nails. These are not aesthetic problems. These changes, such as brittle, discolored, thicker nails, are possible warning signs from your body. They are not unavoidable aspects of aging, rather, they are your body's way of telling you something crucial. Will you pay attention before it's too late? For inappropriate methods for managing incontinence, given how prevalent it is and how frantically individuals attempt to conceal it, this is possibly the most startling hygiene error. More than half of seniors suffer from incontinence in some capacity, but what's even more startling is how many choose to conceal it rather than getting the help they need. Studies show that seniors who effectively manage incontinence issues have 60% fewer complications than those who try to conceal the issue. Urologists at Johns Hopkins Medicine report that untreated incontinence can conceal serious conditions like bladder or prostate cancer and cause dangerous skin infections, falls, and social isolation. Douglas, a 73-year-old Arizonan retired accountant. When Douglas eventually sought help after developing painful sores, doctors found an advanced prostate condition that could have been treated months earlier with much better results. Douglas was too ashamed to tell his doctor about his occasional leakage, so he used paper towels and changed his clothes frequently in the hopes of managing the issue. "I almost lost my life because of my pride," Douglas said. "I wish I had talked to my doctor at the first sign of a problem instead of trying to hide it." What should you do if you have incontinence of any kind? First, don't be embarrassed to talk to your doctor about bladder issues, they see them every day. Instead of using makeshift solutions, use proper absorbent products made specifically for incontinence. To stop skin breakdown, choose solutions that change quickly when wet and adhere to a good cleansing regimen. Most importantly, understand that incontinence is not a natural aspect of aging, rather, it is frequently a sign that you require medical treatment. Do you occasionally leak and find yourself scheduling your activities around the availability of restrooms using makeshift protection? Don't put off discussing these issues with your physician any longer. It could be the difference between your life and your health. Error 5: Mistakes in ear hygiene. How often do you clean your ears? Be honest with yourself. Do you use cotton swabs and enter them far into your ear canal? If so, you're committing a deadly error that many seniors make on a daily basis. Improper ear cleaning causes many older persons to lose their hearing and fail to notice symptoms of serious infections. Otolaryngologo. While ignoring signs of potentially harmful illnesses. According to their research, almost 40% of ear canal injuries in individuals over 65 are caused by incorrect ear cleaning, and many of these cases result in infections that could have been prevented completely. Allow me to introduce you to Patricia, a retired librarian from Washington who is 71 years old. Patricia frequently cleaned the inside of her ears with cotton swabs until she punctured the eardrum, which resulted in a serious infection that spread to surrounding tissue. She said that I had always cleansed my ears in this manner and that no one had ever warned me that it was risky. Patricia needed immediate medical attention and endured. What is the proper method for maintaining good ear hygiene? Keep in mind this straightforward guideline to prevent irreversible hearing loss. Never put anything smaller than your elbow into your ear canal. If you think you have too much wax, use a warm, damp towel to clean just the outside of your ear. See a doctor right away and use eardrops made especially to soften wax, following the advice on the box. Don't try to fix these issues on your own. You need professional medical assistance if you have pain, discharge, hearing changes, itching ears, or ears that feel full or obstructed. Your hearing is valuable, so take care of it properly. 6 Bad foot habits. When was the last time you took the time to examine your feet closely? From toes to heels to soles, every area of your foot holds important information about your circulatory and neurological systems, which is why doctors examine older patients' feet first. According to the American Podiatric Medical Association's elderly podiatrists, poor foot care frequently indicates the onset of vascular disease and diabetic neuropathy. According to their research, up to 85% of diabetes-related amputations in adults over 65 could be avoided with appropriate foot care and routine examinations. Proper foot care could avoid 85% of amputations. Think about my feet had been looking rough for years, but when his doctor noticed them during a routine exam, he ordered diabetes testing right away, catching the disease in its early stages when lifestyle changes could still make a significant difference. Raymond, a 76-year-old retired factory worker from Illinois, believed that the dryness and small cuts on his feet were just normal signs of aging. If my doctor hadn't checked my feet, I might have gone years without realizing I had diabetes. Raymond informed me that by then, there would have been significant damage. What should I do now? Every day, wash and completely dry your feet, paying particular attention to the spaces between your toes where fungus thrives. Check them frequently for wounds. If you experience discomfort, numbness, or sores that don't heal, visit a doctor right away. If your feet are dry and cracked, wear clean, dry socks made of natural fibers or moisture-wicking fabrics. Apply moisturizer to dry areas, but not between the toes. Observe any wounds that aren't healing properly, any odd discoloration, or any loss of feeling. These aren't merely aesthetic problems, they could be early indicators of dangerous disorders that require urgent care. 7 Hygienic concerns associated with medications. When you started using numerous drugs, did you notice any changes in your body odor, perspiration habits, or dry mouth? Your life-sustaining drugs may be generating hygienic issues that indicate harmful side effects. The American Geriatric Society's pharmacologists have reported that some routinely prescribed drugs can result in dry lips, increased perspiration, or changes in body odor that could be signs of toxicity. According to their research, about 40% of senior medication responses start off as changes in personal hygiene requirements before developing into more severe symptoms. Barbara, A 67-year-old Florida-born retired nurse before her geriatrician identified it as an indication of medication toxicity that was gradually harming her liver. Barbara's family dismissed her peculiar body odor as poor hygiene. I was taking regular showers and wearing deodorant, but Barbara explained that I was unaware that the smell was coming from inside my body rather than from a lack of cleanliness. How can you safeguard yourself? Keep notice of any changes in hygiene after beginning a new medicine. Keep a straightforward journal in which you record any changes in your skin, mouth, sweating, or body odor. Never alter dosages without medical supervision, and stay adequately hydrated unless your doctor instructs you otherwise. Report any unusual sweating or changes in odor to your doctor right away, since these could be signs of harmful drug interactions. Have you experienced strange body odor despite taking regular baths, excessive perspiration, or extreme dry mouth, even if you believe the drug is creating hygiene problems? Remember that good hygiene isn't just about appearance or social graces, it's a crucial part of maintaining your health as you age, and these small changes could literally save your life. If you found this information useful, please hit the like button right away. Your doctor may have observed any of these hygiene issues during your visits. You now know the 7 critical hygiene mistakes that doctors immediately notice in their elderly patients and exactly how to correct them. By taking care of these issues today, you can prevent serious health problems, maintain your dignity and independence, and possibly add years to your life. Comment below on your experience, remember to subscribe, and click the bell to receive more possibly life-saving health information. You should also share this video with your loved ones over 60 because it could truly save their lives.